you care about most are safe.
Follow News 1226 on Twitter to keep informed with the latest happening near you.
On your side, this is News 12 at 6 o'clock.
10%, that's all it will take for schools in Richmond County to shut down and people get infected with COVID-19. We answer the what ifs as the first day gets even closer. But first of all, COVID chemicals in Columbia County schools. What's being used to clean, and could it be making things worse?
Our I-team is looking into 2 disinfectants supposed to kill coronavirus. We found it could be what's making Columbia County students and staff sick.
In an all-new I-team investigation, our Meredith Anderson is on your site exposing what your kids are being exposed to.
We gave you this first look.
Now, this is our disinfecting machine?
Just 3 days before the first day of school.
It's pretty good.
Columbia County's intentions are good too. The district armed every one of its high schools with 3 fogging machines. Every elementary and every middle school has 2. In the war against COVID-19, you could call them the big guns, but not perhaps because of how they shoot, more like what they shoot and where and when they're shooting it. A source shared this of a bus being fogged after a route. We're going to play it in real time without editing for time, so you can see just how fast the driver returns. It's roughly 10 seconds before the chemicals have even had a chance to settle. Not even half an hour later, I'm told kids were boarding.
Students and bus drivers may be a little sick from the chemical. Remember, these are poisons, and I'm not surprised at all.
And that was before the executive director of the Georgia Poison Control Center even saw this clip. Dr. Gaylord Lopez watched it after our interview and called it crazy and a very bad idea, all caps.
The school bus is really the hardest.
Lori Stripling says that's where her daughter first noticed a strong chemical smell.
And she said it almost makes my chest burn. When she gets to school, it gets a little bit better, but throughout the day, she tends to get really, really nauseous.
The I-team filed an open records request specifically asking what is the brand and name of the disinfectant used in the foggers. Enviro Solutions ES15 disinfecting cleaner and ES64 disinfectant. We found both on this list and double-checked with the Environmental Protection Agency just to be sure. The N list, as it's called, is a lot like the one the FDA has for emergency drugs. Only this is the EPA and these are emergency cleaners. We kept digging and eventually our shovels hit the details on these 2 documents, the safety data sheets, where, by law, companies have to list all the dirt or possible hazards. Right away, one SDS seems a lot more alarming than the other. For example, this symbol, it warns the ES64 could cause cancer to respiratory problems to organ damage and more. Not good, but Columbia County's Facilities and Maintenance Director says not so fast.
And what you're seeing on the SDS sheets and the information you're looking at comes from the fact it's a concentrate. It's shipped in half-gallon jugs, fully concentrated for a 64:1 dilution ratio.
He also tells our I-team the district has been using the ES64 for more than 4 years now. The only difference? It's now being used in the foggers. So really the new chemical is the ES15. So if anyone is having any sensitivity to something, it would be to the 15, not to the 64 anyway.
It should be, yes, if that were the case.
The I-team sent an open records request for all chemical complaints, and the district sent us 2, both from teachers. One calling the chemical smell overwhelming, saying, "My chest burned immediately. I got a headache and felt a little nauseated. Breathing problems persisted, so I should probably get this checked out." Another teacher is pregnant and says her doctor wrote a note for her not to be in contact with the disinfectant spray. Another doctor tells our I-team he saw several patients with upper respiratory irritation, teachers and maintenance workers who should stay away from the fogging for a week. Associate Superintendent Penny Jackson remembers some bus drivers speaking up that first week.
We had a few that, mentioned, it's a strong smell, or, it's making me, my eyes water, or that sort of thing.
But she tells her I-team it's about to get better. She says this week the district will start installing ionization modules on buses, like they have at the schools. They work with the heater and air conditioner to help clean the air by killing mold, bacteria, and viruses like COVID-19, reducing the need for chemicals.
We were fogging close to, 300 buses 4 times a day, and it was new to everyone. So we had a few bus drivers that might have not waited the 2 minutes to get back on the bus.
That 2 minutes is important because, according to the district, that's how quickly the chemicals dry out. At school, though, teachers and students have a longer wait.
We have a center of protocol request or requires that anyone in an occupied space vacate it for a minimum of 10 minutes before they can come back in.
Georgia's poison control director says this isn't something that should be one size fits all.
Air temperature and air quality, all that's going to play a role. So there's not one specific time, but a lot of times we're throwing out common sense in favor of thinking this is safe and effective.
He says how people react to chemicals isn't the same either, something this mom is seeing firsthand. The first week of school, she says all 3 of her kids had the same symptom.
I need something for my head. My head is about to explode.
After a few days and a few doses of ibuprofen, 2 of her kids were back to normal. She says her oldest, though, still feels sick every day.
Couple minutes of being home and everything settling down. No more runny nose, no more watery eyes, no more symptoms.
She's been trying to tough it out, though, because of marching band. Her dream is to march in a major college program.
It's a wait. Sickness now or future with band. Which weighs more?
If she chooses to go virtual and learn from home, she'll have to sit this season out, putting experience and maybe even scholarships at risk. What are the options here?
There aren't. It's either or. The school board's position is you have to do what is best for your family. And as much as I realize changing her future and that possibility, I can't keep exposing her to something that is physically making her ill.
Meanwhile, Dr. Lopez hopes all school districts will take a hard look at the chemicals they're using. He says no one, not one single school district in the state, has called on his agency to help. He says he hopes that changes because he's worried districts are making mistakes.
It's like trying to kill a fly with a cannonball, and you don't really need those potent of chemicals. And if you do use them, be aware that there exists the potential for untoward effects to happen.
Effects that he worries will linger much longer than the smell. Reporting for the I-Team, Meredith Anderson, on your side.
Let's get a look at the active cases in Columbia County schools as of Friday. 23 students and 9 staffers. That is less than 1% of their staff and less than 1.1% of their student population.
We're also learning of 5 staff cases at Hammond Hill Elementary in North Augusta. Aiken County school officials say the cases happened over a few weeks. None of them are active right now, and at least 1 employee is back at work. They will deep clean the school before kids are back on Monday. Plexiglass separating desks, hand sanitizer around every corner, deep cleaning bathrooms, buses, and everything in between. Just about 2 weeks until school starts in Richmond County, and we're getting a better idea of what the first day back will look like.
Today, district officials are answering our questions on all things from virtual learning to testing positive. Cindy Heiberger is on your side with that.
There's no telling what our local COVID numbers will look like next month or even next week. It's why Richmond County school leaders say trying to plan the safest way to go back to school has been tricky business. But they say they've been busy planning for just about every scenario. As of now, the county says they plan to move forward with their online and face-to-face learning models on September 8th. But that's open to change at their next called board meeting on September 1st.
We will take a look at the current data for our COVID-19 community spread and make a responsible recommendation about how our face-to-face students would start. Will they start virtually for the first 2 weeks, or will we start face-to-face?
Realistically, the school district knows some students and staff members will test positive after returning to school. They say they plan to send notes home to families of children who have been exposed, and they'll start evaluating whether to close a school if 10% of the people in that building test positive. Otherwise, they say whenever someone gets the virus, they plan to do temporary, targeted closures.
We may close a classroom, or we may need to close a part of the building, just temporarily, just long enough to be sure that we deep clean it.
Should all schools need to move to online learning, the district says students will still meet with their same face-to-face teachers. They'll just do it online. Students without computer or Wi-Fi access will be given some leeway.
It is the same standards and the same content. The difference is it's available to be downloaded offline.
Students and staff members are required to wear masks on school buses and in areas where social distancing isn't possible. Now, the school district says they're not going to be able to screen students and staff as they enter into buildings, so they're asking parents to screen their students before they leave the house in the morning. Reporting in Augusta, Sydney Heiberger on your side.
And school leaders want to remind parents to keep those kids home if they aren't feeling well or showing any symptoms. They say there's no limit to the number of sick days a student can take, and there's no penalty for playing it safe. They also tell us each school will have an isolation room should they need that. We'll mask around every corner today as students at Augusta Tech head back to campus for their first day. Masks are required in school buildings. They've got hand sanitizer stations and social distancing signs as well all around the campus. The school is even giving out free face masks tomorrow.
No bond set today for a former state trooper accused of killing a man in Screven County. Jacob Thompson is charged with murder and aggravated assault in the death of Julian Lewis. In court this afternoon, the judge announced he is still reviewing the case and will rule on the bond later. The GBI says Thompson chased Lewis over a broken taillight, but later shot and killed him.
Back to the virus now, and researchers are working hard to learn more about COVID-19. Now, 2 AU students will be part of a research team with the National Institute of Health.
They are 2 of just 50 students in the entire country to be chosen. Nick Proto spoke to one of them before she starts researching on Thursday.
Almost feels surreal that I'm going.
Janice Owens-Walton came to Georgia from England when she was 12. The fourth-year med student is studying urology. She applied to the NIH research program because she felt she was missing that part of her education.
It's also kind of difficult to fit that into your medical school journey. There's always something else that will take precedence, and research is kind of considered an extracurricular activity.
Now she's putting med school on pause as she joins 49 other med students in a year-long research program. She's one of only 2 people from Georgia to be selected, joining another med student from MCG. He already started his research on COVID-19.
And the only way that we're going to be able to really get a handle of this pandemic and create vaccines or examine the long-term effects of COVID is by doing the research to find out why or how or what we need to do better or what we are doing wrong.
She says she's excited to do something she's passionate about while also taking a little break from school.
I'm excited to kind of explore my skills in research, but also explore myself outside of medicine. And
On a scale of 1 to 10, how excited are you for this program right now?
like 27. Like we're off the side.
In Augusta, Nick Proto on your side.
We are keeping a close eye on Marco and Laura. We'll let you give you an update on both of these storms coming up.
We've heard about the dangers of vaping. Now we're learning it can make you more susceptible to coronavirus. We'll explain how in 90 seconds.
VA, 25 people are in the hospital right now at doctors.
We've talked about the dangers of vaping for teens, but now researchers are finding the addicting trait has even more negative side effects.
As Brittany Trabnell explains, young people who use e-cigarettes are more likely to get COVID-19, but AU is working on a way to fight that.
The science and research has come here to AU, getting the students involved to stop a problem that's affecting some of them. Any smoking is no friend to the lungs. Neither is COVID-19.
Not only does it compromise the lung health, it impacts a person's immune system.
Christine O'Meara works with the Georgia Cancer Center at AU. She says vaping and COVID share a scary reality.
Young people who use e-cigarettes are 5 times more likely to be diagnosed with COVID-19.
New research out of Stanford shows 13 to 24-year-olds who vape are more likely to experience symptoms. It even can cause and aggravate pre-existing conditions.
It does suppress the immune system cells, the immune cells in the nose.
Which brings concern as school starts back. A 2019 CDC study showed 31% of high school students used a tobacco product in the past 30 days.
This hand-to-mouth behavior with the use of e-cigarettes also is increasing the opportunity for transmission of the virus.
So on campus at AU, O'Mara is working with a communications class to create 30-second public service announcements they aim to convince e-cigarette users to quit by the end of the pandemic. Another effort to keep students safe while they learn how to learn with the risk of COVID. Those student PSA videos will be produced in October and likely shown around campus to keep this issue on everyone's mind. Reporting in Augusta, Brady Trapnell on your side.
AU Health is also doing a tobacco quitting program. There are classes every week. We'll have that info on Wrdw.com.
To weather now, if you've come here for sun